Hello, hello, Magic 102.1 listeners. This is Sky Houston. And last year, we partnered with Aetna to bring you Black Health 365. Well, we gave you the straight facts about diseases, illnesses that impact Black America. Now, whether that was heart disease, stroke, cancer, COVID, we connect you to the resource to help prevent these diseases. So today, I'm super excited to have with us in the conversation Dr. Alena Baquet-Simpson. She is the executive medical director at Aetna, and she's here to talk about heart health and specifically how it affects African Americans. Dr. Alena, welcome.
Thank you. Good morning, and I really appreciate you having me on the show today. I'd like to start, if that's okay, by going over some terminology. Will that work?
Please, absolutely.
So, we hear a lot of different things out there, like cardiovascular disease, heart disease, coronary artery disease, and sometimes we use those as if they mean the same thing. So, I just wanted to clarify that while they're related, they're somewhat different, and I wanted everyone to understand. So, starting at the highest level, we have cardiovascular disease. These are conditions that affect the heart and the blood vessels,
Mm-hmm.
and it cardiovascular disease is this big umbrella that has under other things under it, like heart disease. And with heart disease, we have coronary artery disease. People are familiar with hearing about blockage of the arteries that lead
Mm-hmm.
to heart attacks. That's coronary artery disease, and it makes up about 60%
Wow.
of heart disease.
Wow.
But also under heart disease, we have heart failure.
Mm-hmm.
And then under the big umbrella of cardiovascular disease, you mentioned stroke. We also have stroke, and we have peripheral vascular disease where you're not having good circulation in your legs.
Mm-hmm.
So, cardiovascular disease is the leading cause of death in the US, is responsible for over 800,000 deaths annually, or 1 in 3 deaths. And this goes across whether it's men, women, all different racial and ethnic groups. It's really a public health problem.
Mm-hmm.
And one group that is really particularly and disproportionately affected are Black women.
Wow. Wow.
I could tell you a little more about that. So, stroke, which is part of that cardiovascular disease,
Right.
is the number one leading cause of death for Black women. It kills about 50,000 annually. And when we think about Black women who are 20 and older,
Mm-hmm.
59% have some type of cardiovascular disease.
You said 20 and up. That's such a young age. When do you start having signs? If it can start so young, when can you start seeing signs? Or can you live 20, 30, 40 more years before it's really affecting you?
Well, the signs can happen at any time. Honestly, what the concern is that you can have the risk factors and do things, and we'll go over those hopefully in a little bit.
Mm-hmm.
But you can be building up plaque in your arteries, for example. That could start even in childhood or adolescence. You might not necessarily feel that, but by the time you get to adulthood, then you're already at higher risk for having the complications like heart attack and some of the other issues. So you may not see the signs, but even if you don't feel anything, it's important that we take good care of ourselves to avoid these complications later. What we do when we're young impacts us later.
Absolutely. And doctor, what are some of the drivers of those, disparities that you mentioned earlier about Black women, 50,000 annually from stroke? Like, what are some of the insights to those drivers?
Well, and also with Black women, they're like 50% more likely to experience heart failure and 3 times more likely to die from it. But there are many different drivers. Let's start by talking about looking at research. When there's clinical trials to look at cardiovascular disease, heart disease, of all of the participants, only about 38% are women. And then in a recent publication in Cell Reports Medicine, which looked not only in the US but across the globe, of the women participating, only 3.2% were Black, including African Americans. And so that leaves this huge gap in terms of medical understanding and about the Black health experience for women and for others. Another issue is that from our CVS data as well as Harris poll data, we know that because of different biases that exist, there's a lack of health education that's provided to underrepresented groups like Black women and African Americans in general.
Hmm.
And this can negatively impact cardiovascular health. And there's a lack of health literacy around it, and just a lack of understanding on the part of patients as well as providers. And this causes a delay in seeking care, a delay in also treatment that's being offered. So this is a reason for some of the disparities. Another thing is when you don't understand,
Hmm.
then you're not on the lookout for it, and
Right.
again that leads to a delay in seeking care. So I think it's really important to go over some of the signs and symptoms for at least two of the major conditions: heart attack and stroke. Heart attack and stroke are the ones that I'd like to leave today with people having a better understanding about what to look for. With heart attack, most people realize that there's chest pain, but it's this uncomfortable pressure or squeezing pain, a fullness in the center of the chest that
Hmm.
lasts more than a few minutes, or it might come and then go away, but then come back.
Hmm.
But there can also be, and this is what people miss sometimes, there can also be pain in the neck, in the jaw, in one or both arms, in the back or stomach. There can
Hmm.
be shortness of breath, you have trouble breathing,
Yeah.
with or without the chest comfort. You could break out in a cold sweat. You could be dizzy or lightheaded and have nausea.
Hmm.
And then for stroke, the key here is that things happen very quickly. There's sudden onset
Yeah.
of numbness, tingling, weakness in your face um, or your arms and legs, especially if it's on one side.
Hmm.
You might have trouble being confused or understanding or having trouble speaking. You might have blurred vision. You might have trouble walking or dizziness, and or have a severe headache without a good reason for why that happened.
Hmm.
So that's what you really want to be on the lookout for and seek care immediately if you have these things happen.
Do you find, doctor, that many times people go through some of those symptoms and they brush them off as, hey, I could, the one I used to hear, go drink some water and lay down, it'll pass over. Do you find that culturally we're more apt to bypass the signs?
Yes, and that's because of not really fully understanding that this is, what's happening.
Hmm.
Again, it's that health literacy related to the cardiovascular disease, not understanding what's happening and how important it is to respond quickly, to not delay, to go get care.
Are there any other misconceptions that you think
So,
that we have about heart health? That what other misconceptions are out there?
well, there's two that come to mind for me. One is it has been around a long time and we've been trying to deal with it, and that is that heart disease, cardiovascular disease, that it's a man's problem,
Mm.
that women don't have to worry about it. And obviously, from some of the stats I've been sharing with you, that that's not the case.
Mm-hmm.
And that's why the American Heart Association started that Go Red for Women campaign in the
Mm-hmm.
early 2000s. But the other one is what we were also just talking about a few minutes ago, and that's that young people are exempt from, the risk of heart disease, that it doesn't impact them.
Mm-hmm.
But again, I just want to emphasize that the choices we make when we're younger impacts us later in life. So we need to we really need to jump on that. And we talked about the alarming stat about Black women age 20 and older.
Mm-hmm.
When we look at the total population in the U.S. age 20 and over, almost one in two, almost 50% of people have some kind of cardiovascular disease. Yes, it's higher in Black women, but it's high overall as well.
What
But
is
there
that?
is good news.
Oh, I was going to ask, give me some good news in that regard, doctor.
So we know that cardiovascular disease is a big problem. We know we need to act quickly. We know the symptoms. So the good news is that most of it, researchers have determined that up to 90% can be prevented by knowing the risk factors and doing something to correct them.
Okay.
So let's talk about those risk factors,
Let's
right?
talk
It's
about
going to be,
those.
yep, elevated blood pressure, elevated low density lipoprotein, LDL, or the bad cholesterol
Hmm.
that leads to blockage in the artery.
Doctor, I'm
Go ahead.
sorry. For the sake of education, please double down on what that bad cholesterol is. What is bad cholesterol?
We have a total cholesterol level, and then there are different components of the cholesterol.
Hmm.
There's a bad one that you want to keep that number low, and that's the one that's associated with leading to the plaque buildup that blocks the arteries, that leads to the heart attacks and so on.
Okay.
So that's the one that we want to keep that number low, at least less than 100. But then there's a good cholesterol, which is, so the bad cholesterol is called LDL, low density lipoprotein.
Mm-hmm.
There's a good cholesterol, HDL, high density lipoprotein,
Okay.
which actually has a protective effect. And we want that one to be higher,
Okay.
usually above 50 or so. But other risk factors are diabetes, smoking, obesity, or being overweight, inactivity, consumption of too much alcohol, poor diet, of course, if it's going to be high in salt and unsaturated fat, and also stress.
Yeah.
There's studies on now about chronic stress, like stress that we may encounter from years and years of structural racism, for example, and what impact that might have on heart health. So it'll be interesting to see the results of that research as it comes out. But for all of these, if you think about, Sky, if you think about all of those risk factors we talked about,
Mm-hmm.
we can do something about it. It's not things
Please
that can't be changed.
tell me, give me, if there was someone who was looking to improve their own heart health, what can they do? Because as I hear LDL and high salt and saturated fat, I'm already thinking, okay, what can I do? So tell us some things people can do to improve on their own.
Well, you want to go in and have a regular checkup with your doctor. You've probably heard over the years, know your numbers. What they talk about with that is know what your blood pressure is,
Mm-hmm.
know what the level is, know what your glucose is or your hemoglobin A1C that tells your glucose level over the last 3 months or so.
Mm-hmm.
If those are elevated, work on a plan with your doctor to get them controlled, whether that be through, you might need medication. It might be your diet. It might be a combination of diet, medication, exercise,
Mm-hmm.
but those things can be improved. Don't smoke. Try to have a healthy weight, or if you are overweight,
Uh-huh.
try to lose at least some weight. You may not have to get down to ideal weight, but just losing some weight has a beneficial effect. Inactivity, you want to start exercising. And again, that's good to do that once you've talked with your doctor. But your diet, you know, have a diet that has more fruits and vegetables,
Mm-hmm.
more whole grains in it, things like that. Alcohol intake, it's not saying don't drink, but don't do binge drinking, don't do
Mm-hmm.
excessive drinking. For women, the recommendation is no more than one drink a day. For men, it's two, and then drink. Now we're not talking about like some huge glass of alcohol. We're,
Mm-hmm.
we're talking about maybe 5 ounces of wine, or
Yes.
something reasonable. It needs to be, especially red wine, seems to be helpful. But I mean, I wouldn't suggest that everyone start drinking wine every day. But if you are drinking it, drink it in moderation.
Get with your
And
doctor.
you probably don't want to do it with your doctor. Sometimes it can have a negative impact on sleep. So be careful. It helps you fall asleep, but then you wake up.
Mm-hmm.
So again, you have to be in tune with your body and work with your doctor on the plan
Yes.
that works for you.
So, doctor, tell me this: what are CVS Health and Aetna doing to support people in their journey to reach and maintain that optimal heart health?
We do recognize cardiovascular disease as an issue that can impact every American. We feel
Mm-hmm.
really strongly about that. So we look for like-minded organizations to work with to foster real change. And
Mm-hmm.
one example of what we do is every year in our CVS pharmacies, we have a fundraising campaign to support the American Heart Association. And then separate from that, our foundation has awarded the American Heart Association $1 million over 2 years to help address hypertension.
Mm-hmm.
We have uh, been supporters of Go Red for Women for the last several years, and our company-wide health equity activities are focused on controlling blood pressure.
Mm-hmm.
I specifically work with the Medicare area, and the health equity work that we're doing is, in addition to focusing on blood pressure, we're focusing on controlling diabetes.
Mm-hmm.
But the other thing that we try to do is to design our products and our services to be able to support people on their journey, making sure that they have what they need so that they're empowered with the tools that they need to take care of their own heart health and be good advocates for themselves.
Wonderful. Do you have any other ideas or creative ways you think we as individuals can get the word out or to help others get educated?
Well, I think again, just talking to family, talking
Mhm.
to friends, talking, when you're in organizations and there's an opportunity for these topics to come up, doing what you're doing, having, these radio shows that where the public can tune in and get good information. But I think raising awareness and about what the different types of cardiovascular disease are, what the risk factors are, and how to recognize that, and just encouraging people to get the treatment that they need and advocate for themselves. If they're feeling something's not right with their bodies, then don't just sit back. Go and get help.
Absolutely. Dr. Alena Simpson, I appreciate you calling in and letting us know, or keep this top of mind, because I think we do forget. We get rolling in our everyday routine and we forget taking care of ourselves can keep us in that routine. If we want to be around for a little longer, paying attention to this really is a big deal. We're talking heart health and how it affects African Americans. Dr. Alena, your final word to our audience.
Just be your own best advocate. And thank you so much for having me.